I think as VillageReach, as an organization, our approach has always been to work with governments in the number of countries where we work in to really develop and taste solutions that, if they are successful, those solutions are then taken to scale. So I think in answering this question, I must say that, our thinking around this has, has kind of evolved. So not changed exactly, but evolved. I think as we are learning from the implementation. And I think what's critical for us is always, what is it that we are transferring? So what is the solution? How does it work? Where's the evidence that it works? And I think all that needs to be packaged. And that's what we're learning, that I think as we're defining success, we are not only looking at outcomes of the program, but we are looking at the small steps that lead to those outcomes being achieved. So a lot of our work in Malawi that has changed has been around, for example, we have recently transitioned Chipata Chapafoni, which I would say in English, Health Center by Phone, to the Minister of Health. A lot of that has been with the Minister of Health documenting what does it mean to develop and manage the solution to achieve the outcomes that we have seen. So that has been the kind of evolution that we have seen, I think, in our own definition of, around this question. And two specific things that I wanted to talk about. One is adaptability that we are learning. So how does the solution, as we're talking about the scaling journey, how does it adapt to emerging community needs and also other needs in the environment? And we talk about COVID-19 now, and the solution that we've transitioned to the Minister of Health has been able to adapt and include COVID-19 response effectively as part of the solution. That has not been easy with some challenges, but we have seen that when you think about the scaling journey, we must always define success in how solutions can adapt in the context that we are looking at. I think the other thing that I can talk about is when we thought about transitioning and the scaling journey, you think about handing over a solution to government and government being able to do everything that an NGO like us were doing with that solution as they take it to scale. And that is not always true, I think, as we're seeing. So the definition of success there may mean how we are able to collaboratively bring on board various stakeholders, communities, private sector, other local non-governmental organizations to do elements of the solution that government is not able to, but still define the transfer as successful because government is still managing and owning the solution, but in partnership with others, implementing that. And ultimately also what we are learning is the realities around the scaling journey is a timeline in our case with the Health Center by Phone that sometimes we have well-defined timelines, but things don't always work according to plan. And that we are being reminded we need to celebrate these small successes. So in our transition here, we have seen government putting in place several measures, engaging with private sector for the Health Center by Phone so they can continue to zero-rate calls that are coming in, government putting in place staffing, government starting to allocate some budget, but those take time. And I think ultimately what we are learning from this caring journey is how we should celebrate these small successes and document these processes as successes that collectively are being achieved. So thank you very much.